I haven't necessarily always wanted to be a scientist. It wasn't until actually I qualified as a junior doctor and I got to be involved in a research project where we collected all the data. I was absolutely fascinated to find out what the answer was, and I couldn't wait to analyse it, get the answer to our research question. And I think that first experience of doing that, the sort of thrill of finding out the answer to the research question has never really worn off. So it's one of those things that I've just continued to do. Sydenham's chorea is a neuropsychiatric condition, so it affects the brain. It used to be called St Vitus's dance, and it's an autoimmune condition, so it can come after infection with the bacteria Streptococcus. Is that children and adolescents mostly can develop a movement disorder, and this movement disorder involves involuntary movements, so movements that the children and young people, they can't help making. And one of the reasons why I'm quite keen on this particular topic and this condition is that it includes both children's mental health and their physical health, because the condition has symptoms of both. It's always been considered to be a very rare disease, and at one point it was considered to be a thing of the past, and it's become increasingly apparent that that's not the case and that there are cases being seen. So what we want to do is the first ever surveillance study. We already have funding to do our surveillance with paediatricians, but we have no funding to do it with child and adolescent psychiatrists. And as I was saying, because this is a condition which has both physical and mental health aspects to it, it's really, really important that we can do our surveillance with both. We applied for the Helen H Lawson paediatric grant. When you're fairly early in your career, you need to be able to, get some grants to get yourself going, to investigate some of your initial ideas. And you're not necessarily that well known at that stage, or some of the larger grants can be very complex to negotiate. So something like this, where you can get your first foot on the ladder, so to speak, and you can run your own project in a really well supported way, is something that's really, really valuable to people who are quite early on in their career. The ultimate aim of this is to improve care for children and young people with Sydenham's chorea and their families. That's kind of the bottom line, really. We're working with the Sydenham's Chorea Association, so that's a family charity. So that includes the families of children and young people with Sydenham's chorea, and also some expert clinicians. Families have told us about how, confusing and frightening the diagnosis can be, and when they see children making the movements, the choreic movements, it's really quite an unusual thing to see, and it can be very frightening for children and for parents as well, because this can often start quite suddenly and with no clear reason why. And children also, sometimes when they're very unwell with the chorea, they may need to be admitted to hospital, they might not be able to walk or to feed themselves, so it can really have a very strong impact. So I think one of the really important things that this grant is going to do is actually help us provide better information for families about what to expect, maybe make things a little bit less frightening or confusing for them, and also provide information for clinicians so that they can better support families, because often families have to be the expert in their own rare condition, and maybe we can help support clinicians to support them better.